Facing a medical crisis is emotionally challenging, even more so when the patient is a child. But new procedures and treatments are helping sick kids get better. He may be small, but 6-year-old Isaac Escobedo is tough.
Yeah, 3, 4.
Not long ago, he faced a diagnosis that put him and his family to the test.
An osteosarcoma is a malignant bone tumor.
In other words, bone cancer. In the past, treatment for Isaac's condition meant leg amputation at the thigh.
The artificial leg would have to fit onto a short stump of the leg, and basically their function would be very limited.
Instead, his doctors used a new procedure called rotationplasty that not only removed the tumor, but saved much of his leg.
We save the artery, the vein, and the main nerve, the sciatic nerve.
The lower leg is turned 180 degrees and then attached to the femur.
So essentially the ankle joint now becomes the new knee joint, and the foot acts as a lever to power his artificial leg.
Isaac's been on the go ever since.
He can play, jump, just like normal kids.
So far, no sign of any more tumors. Doctors say Isaac is cancer-free.
Look, use all your mirrors and look.
Carolyn Allen is keeping her hands on the wheel and her eyes on the road ahead.
You're doing good.
Looking ahead is a challenge for Carolyn, who spent the last 4 years debilitated by Crohn's disease.
I felt sick 24/7.
Crohn's is an inflammatory bowel disease that affects about 500,000 Americans. It causes the intestinal lining to become inflamed. Symptoms include severe abdominal pain, diarrhea, vomiting, nausea, and bleeding.
People aren't aware that Crohn's disease can affect children. The parents will assume it's a flu, and it goes on and on and on.
Carolyn got some relief by taking steroids and other drugs, but that caused her weight to jump from 70 to 130 pounds.
She never really had a good, what we would call, remission of her disease.
Okay, honey, so we're going to do that arm.
Carolyn Allen became the first child in the world to take part in a study using the drug Humira, which is widely used to treat adults with Crohn's and other autoimmune diseases.
It is a antibody against a chemical that starts the inflammatory cascade in your body called tumor necrosis factor.
There are risks.
There is a concern that when you modify the immune system somehow, that there might be some small risk of cancer or lymphoma.
Carolyn says the risk is worth it. She no longer feels sick.
Crohn's doesn't exist in me anymore. I feel completely normal.